All right, thank you, Chastity. All right, here's something to think about. If you got into a severe accident that left you unconscious, you were rushed to the emergency room, how would your doctor know what medications you're allergic to? Your doctor would be able to follow a paper trail, but that could take more time than you have. That's why Springhill Medical Center in Mobile is joining a number of hospitals across the nation that are using electronic health records. Mark Kilborn tells you what they are. This morning, we're in the emergency room at Springhill Medical Center, and I am with Mark Kilborn. He's the Chief Information Officer here, and we're talking about electronic health record. Thank you so much for joining us.
It's my pleasure.
Talk to me a little bit about the electronic health record versus the old paper method.
Well, I think a good analogy of that would be to go back to Hurricane Katrina and imagine here and today if we had that same type of event. Back when Katrina happened, you had all these hundreds, if not thousands, of patients who their health care, their medical history was erased.
Right.
So then you've got patients showing up in different health care or different hospitals around the country, and perhaps they've been on dialysis, perhaps they've been on chemotherapy, and those patients have no idea whatsoever of what the strength, what type of treatments, certainly not enough information to give to a physician to adequately care for them. So the physician coming in here, if he's got two patients, this one's on paper, he has to come up with a care plan, a treatment plan based on his observations and the diagnostic information that he gets right then and there.
Right.
Whereas if you're on an electronic health record, he has every bit of information of your patient history. If you'd gone to the doctor that morning, chances are that record is sitting there. So he can obviously do a much better job of taking care of you, getting you the right care that you need.
So it makes things easier on the doctor as well as the patient.
Easier on the doctor, I don't know that it makes it easier on the physician, but it certainly gives him all of that comprehensive information he needs to make sure that you have the very best outcome you possibly can.
All right, now let's go in your office and talk a little more about this.
Yes, ma'am.
Now, what about, a lot of people are concerned about having their health records online, on the internet. What about security?
Well, security is an ongoing challenge, no ifs, ands, or buts about it. Every business has a security challenge. And generally, when you talk about people trying to break into computers, anybody trying to get into our systems, 99% of the time, they're not here to get your personal health care information. They're here to try and break in and get financial access, to get access to money. Now, I cannot go into great detail about what steps we take to prevent that, but I can tell you that under the HIPAA guidelines and the incentive program, we have to be able to track every single person that looked at your health care record while you were in our organization. We have to do risk analysis on a yearly basis. We actually do it on a monthly basis. We go out and select specific accounts. We look at them to see who accessed that account. Did they have the authority and a just reason to be in there? Were they authorized to look at your record? And we have to be able to report that information back to the government as well. It's tremendous advantage to what you can do with this technology. In the paper world, if I write an order, I put it in a basket, someone comes and gets that basket, unless, of course, it's an urgent request, a stat request, but I put it in a basket, somebody comes, picks it up, takes it to the department, it gets put in a queue, and eventually it's going to, not eventually, but it's going to be acted upon, and that averages about 330 minutes if you do it by paper. If you do it electronically, it's less than an hour.
Wow.
So instead of waiting a couple of hours for perhaps an antibiotic or something to be administered to you, you're going to get it immediately within an hour, and that's huge in patient care. So
basically a lot of benefits to the patients.
Tremendous benefits to the patient.
Of the inside.